Hello, everyone. I'm Dr. Darsh Shah.
And I'm Dr. Altamash Raja.
And welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare. Here's a quick word about today's sponsor for this episode. Do you need access to cash at fair rates? Doc2Doc Lending believes that when debt can be avoided, it should be. They also realize, however, that sometimes borrowing is necessary to help doctors overcome short-term cash issues to improve long-term personal financial health. Founded and led by fellow doctors, all of whom started out as cash-strapped residents, Doc2Doc Lending exists not only to meet doctors in their moments of need, but to do so in a way that assesses and appreciates each doctor borrower as only fellow physicians can. Apply for the loan you need with Doc2Doc Lending at drpodcastnetwork.com/Doc2Doc. That's drpodcastnetwork.com/Doc and the number 2 Doc. And now let's get to the episode.
All right, guys, welcome back to another Lessons Learned with Dr. Darsh and Shah.
Hello, hello.
What's up, buddy? How are you?
I'm doing well. How about yourself?
Good, man. Good. It's been a great day. Got a good Zone 2 workout this morning on the treadmill. That's a new one for me. I didn't know if I could get my heart rate up that high, but got to go to about 11 to 13% incline, 3.1 speed, and get up there. That's pretty good.
Nice. Yeah. That's what I realized. My Zone 2 is like, wow, I have to go so slow. Like my heart rate will just go up so quickly. I mean, not quickly, but I mean, what's that?
You using bike?
I usually do a treadmill. I usually do a speed walk.
Yeah.
Yeah, like 4 miles per hour-ish. Yeah. I don't know.
I'm actually considering investing in some type of... So I've got an Airdyne bike, but it's not the greatest for Zone 2, right? It's just really annoying to kind of do that. And I don't know. I don't know if it's just so many... My wife was just like, do we really want to move this? We've kind of gotten so comfortable. It's going to be a pain to move in 4 months.
Yeah, I know, about to move. I know, yeah.
But Zone 2, I need Zone 2.
Anyways. I need a Zone 2 in my life.
Anyways, but what are we talking about today, right? We recently had Dan Pope. I really enjoyed our conversation with him. Dan is so knowledgeable, such an awesome dude. So I really, really enjoyed our conversation. I'm so happy that he was able to make some time. Honestly, I had more questions than answers after our discussion, and I feel like we barely got to even scratch the surface with him. But duty had to call, and he had to see a patient. So hopefully we'll get him back and kind of dive a little bit deeper into some of the topics. But what were your key takeaways, man? What'd you learn?
Yeah, absolutely. So Dan Pope, talking about fitness, pain-free fitness, if I can speak properly. He kind of started off with a very similar theme as what David O'Tay, right, from our second episode was talking about in terms of building rapport with your clients. The biggest thing I took away, one of them was at least the connection, right? He used to give his phone number out, or he still does. He still gives his phone number out to his clients, right? Because that's how you build that trust. That's how you get people to buy into what you're saying, right? And he even said, he's like, sometimes he'll get clients that come from one physical therapist to him, and he'll ask, oh, why'd you leave that other physical therapist? And they'll say, oh, well, they told me, X, Y, Z. And in his mind, he's like, well, I'm also going to tell you X, Y, Z. But the difference is I'm going to build a therapeutic relationship, right? I'm going to be vulnerable myself, and hopefully you become vulnerable, and together we'll kind of, traverse this journey and get you better.
Yeah, I think they specifically think, because it stuck with me, he said therapeutic alliance is going to affect outcomes. I love that. I'm stealing that up. I got to let them know. But yeah, I love that building rapport thing. And, people will just start to hear this common theme. And we keep talking about this, and I love it. It's because these are things that work. The other thing on that front that when he had talked about is how do you get these people to buy in, is he said you got to walk the walk, right? I mean, a lot of his clients and patients are these individuals who are powerlifters and who are CrossFitters and stuff, and he's educated in that front. I think he has a CrossFit Level 1 coach. He was a strongman competitor for a long time. He trains hard. He continues to do that. He puts a lot of these videos out on his social. You get to see that he's actually active. And as Simone Mabin, one of our previous guests had talked about, or you got to walk the talk, as she liked to say. And this is why I think individuals such as what's his name, Spencer Nadolsky, right? On he's really big. They got really big 15, 20 years ago because I think when he first came out, his name was the doc who lifts, right?
Right. Yeah.
And I mean, unfortunately, and I don't want to offend my physician colleagues, but I think us physicians, we weren't recognized as individuals who were exercising a lot. I think a lot of that has changed. We've gotten significantly better, and especially in our professions, we're very much tuned to exercise. But doctors didn't used to exercise a lot. We weren't well known for training hard.
Yeah.
And definitely not with any meaningful intensity. And so I think that was really, really important. But to me, one of the first points, that really kind of resonated with me is just his journey. His inspiration to become a physical therapist was the fact that he was seeing all these individuals when he was a strength and conditioning coach. And as they were getting injured, they were going to physical therapists and they're being told by the physical therapist, oh, well, you shouldn't have been deadlifting in the first place, or you shouldn't be overhead pressing in the first place. And it's like, what? That's not good advice. And then unfortunately, these individuals, because they don't know any better, right? That specific patient doesn't know any better. They would tend to villainize him because he's the one who was doing the programming. And that wasn't necessarily true. Like, it wasn't the exercise that caused the problem, right? Maybe something deeper than that. So, his passion for walking down that journey and getting that extra medical training was so he can continue helping those individuals rather than turning them away or sending them out. So I really love that. And that kind of resonated with me because that's the reason I went to medicine, right? So I can look at the big picture beyond that.
Oh, no, I was just about to say that. I think it's a lot of reasons why, we see a lot of career changes in medicine, right? Especially people becoming physicians, because they want to be the ones that, they see what happens, but oftentimes as an MD or DO, you're the one making that last final choice. And I think a lot of people would like to have that because they've seen that, hey, with their previous jobs or something, they weren't able to influence in that way. So yeah, it was really cool to see him wanting to personally develop self-improvement and get better and become a master at his craft.
For sure. And I think I love their complete model. And I don't think he said that. He did allude to the fact that they're cash-based at Champion PT and they're very special in that regard in terms of the clients and populations, again, the relationships they have with physicians. But what I love is they call themselves performance-based therapy, right? That's what the model is. They built a gym at the facility and then they built the physical therapy around it. They didn't do it the other way around. And that was very intentional. According to what Mike always talks about on his podcast. Mike Reynolds is kind of one of the co-founders and Champion up there. And they don't say they necessarily do physical therapy because there are a lot of individuals, like he says, they walk that line between sports medicine and performance and rehab. And, I would like to be one of those individuals down the road for myself. I kind of consider, and this isn't a plug for myself or trying to toot my own horn, but I think it's extremely important to understand for patients and for colleagues when you're referring out that you're sending to somebody who truly understands what the issue is, right? And for patients, example, I don't know how closely you follow CrossFit, but Matt Frazier, you heard of him?
Mm-hmm. Yeah.
Right. I mean, only the fittest man 5 times. It's insane. The guy's an absolute nut job, right? But I think his story he talks about is there was a point where he was going through a back injury and could only deadlift like 200 pounds or something. And he went to go see the physician, and the physician was like, "Whoa, you can deadlift 200 pounds? Like, you shouldn't be doing more than that." And he now this is a 500-pound deadlifter who's below 50% his normal capacity, and it's like, what are you talking about? But to the physician who necessarily didn't work out, or it seems like a lot, doesn't understand the deadlift, the exercise, and all that stuff, doesn't see that's a disability. Like, our profession, that's what we do, right? I think most individuals, when they think of disability, they see an individual in a wheelchair, or they see a kid with some type of congenital abnormality. But disability comes in all shapes and sizes. It doesn't discriminate, right? It's any type of impairment in the quality of life, whatever we're talking about. As Dr. Arndt previously said, performance is function. And your function, if it's impaired, whether it's lifting, not being able to lift 500 pounds, or not being able to get this can of soup from the cupboard up top, whatever that means, like, we got to be there to help them, individuals, right? Get over that. And so that's my little spiel of what PM&R is all about, I guess.
Yeah, no, I love that, right? And it transitions to my next point very nicely, where I ask Dan about movement, right? Because in medicine, we know back in the day, it's not even too long ago, when people had injuries, we would say, oh, bed rest, right? Like, you got to rest whatever's injured, don't move, let it heal, and then you can get back into what you're doing. And now we've obviously flipped the script on that, and we're saying, hey, movement's actually what's going to keep this pain away, right? Not obviously going 10 out of 10 intensity, but getting some movement in, getting that blood flow. We know that there's advantages to moving even when you get that back injury, right? And what Dan says is, movement can be the medicine, or it can also be the poison, right? And he talks about like taking an aspirin for a headache or something, where you can take a couple and that might help your headache, but you can take the whole bottle and you might be dead. So, right. It's not aspirin that's the issue. It's the dosing of it. So I thought that was a super cool analogy.
We know that exercise is medicine. There's no disputing that. How does it work? Well, it's a complex phenomenon in terms of its therapeutic benefits, and it's probably out of the scope of this discussion and to get the complex physiology of how it's helping. But he touched on the concept of unloading when athletes do come to him, when they're injured and training through injury. And I think he had mentioned that he didn't necessarily like that. I would suggest the term deloading instead, right? When you're basically, whatever the component that's causing you stress, unwanted stress, negative stress, and you take load off of that, but you put it on in a different way. For instance, if somebody has issues deadlifting, right? I think you have a history of this when somebody was like, don't deadlift, and you're like, this doesn't really make sense, right? We know that deadlifting causes somewhat of a shearing force on the spine. And that isn't necessarily always good. But the spine, the axial spine, is really good, does a good job for the most part to take compressive forces, right? So if maybe somebody can't tolerate deadlifting because of their back, but maybe they can do a back squat, okay? Maybe if they're bending forward too much and it's still going to cause that shearing force, maybe they can do a front squat. If the front squat doesn't work, maybe they can do a goblet squat. There's a ton of variations. That's called switching up exercise. That's exercise selection. But he talked about, I think specifically when you asked him, hey, how do you manipulate the variables? There are so many of them. We have frequency, exercise selection I just touched on. You can modify intensity, you can modify volume. Some of them combined becomes load. And his response, it's like art. I forget exactly what he said, but it was really funny, even though he's not an art fan. But I think specifically he was talking to coaches and trainers and physical therapists, said we have to learn how to dose stress. That's exactly what you said, in other words. But I mean, that was something that I really like. And one of his principles in learning how to dose stress is he wants to mimic, as a physical therapist, he wants to mimic, especially when he's seeing an athlete who's injured and can't, maybe is out of season. So he wants to mimic their sport or whatever activity they might be doing. And for us, if we're not seeing athletes, I mean, I'm going to be going to sports medicine. Hopefully you're going to follow me down that path. I'd love to have you. But for individuals who aren't necessarily quote unquote athletes, I always say, not to sound like a punk here, but people are still training for the sport of life. You have to train for it, right? So whatever that activity is, you need to do, right? So that really, really kind of struck a chord with me as well, because this is something that boggles my mind when individuals say, okay, well, you're hurt, just not, don't train, don't exercise. I think specifically the example they used for back, it's a little bit more complex. Core muscle injuries, training around them is very, very challenging. You definitely need an expert like Dan or Devesh, my coach, or somebody like that to be able to do it, who really understands how to dose these variables, how to dose stress. But when people don't train because they hurt their ankle or they hurt their hand or shoulder or an extremity, and there's a million ways to do that, you're really doing your athletes and individuals a disservice because of the effect you're going to get from deconditioning, and they're going to come back to that activity and be much more susceptible to injury. It drives me insane.
Exactly, man. So it's funny. I was actually in the sauna the other day, and like this guy comes in. He's like, "Oh, are you training for anything?" Like, I see you doing like pull-ups. You got a good form. Like, oh, what do you do? Are you training for something? I was like, I stop, take a deep breath. I look at him. I was like, I'm training for life. Pretty sure he just walked out right after.
Yeah, he hates you, so this guy's an absolute douchebag.
I was like, great, the sauna all to myself. So it's a perfect response for if you want to be left alone in the sauna, not talk to anyone. Just say you're training for life.
People just kind of look at you like, what the hell are you talking about? And it's, at the sake of not being a prick, but it's true, man. It's so true. Because like as we get older, how often does it happen that stories you hear, you're like, oh man, I threw my back out, quote unquote. I was picking up my child or my grandson and stuff, and that happened. It's like, if your tissues aren't resilient, if you don't have the tissue capacity to do X, Y, and Z, I mean, you're gonna get injured. That's just that's the nature of the game. I mean, that's
exactly. No, I like to think of it in terms of like what David Goggins trains and how Peter Attia trains, right? And fusing the two together, where David Goggins is literally training for life. Like that dude is just a bad mofo, right? Like he will train because he wants nothing in his way, right? Whenever there's hardship. And I look at that same way, right? You build a mindset around pain, around chronic injury, all these things. And you look at what Peter Attia says, and he says, you also train for life, in the sense that when you're 80 or you're 90, you want to be able to reach above, the fridge or whatever, if you have a microwave up top, whatever. If you need to bend over and pick your great grandkids, hopefully, if we be able to live that long and stuff. But like, fusing those two mindsets, I think, is what motivates me to go to the gym almost every day and put the work in. So.
Yeah, I love that. I mean, for his Centurion Olympics, he talked. I mean, it's like 20 activities or something. I know a perfect goblet squat is important because you got to be able to pick up your. I don't know. I mean, it's got to be. It's what's his model that he talks about? You're unconsciously conscious or something. Like he has like 4 criteria about basically going from basic to master. Right? It's. Man, I don't know. I'll have to look it up and to talk about that, but basically to kind of the unconsciously conscious or whatever it is, to drop into goblet squat and pick up your grandchild. I mean, yeah, that takes a lot of reps. You got to do a lot of perfect goblet squats to be able to get there. And if you don't train, and if you're missing out on time when you're getting injured to not practice those goblet squats or practice body weight form or something else, then it's going to be hard. It's going to be hard for it to become unconscious and just become second nature, or the principle of automaticity is another way to describe it.
Absolutely.
Another thing that I love, and it's not something new because David Ote's talked about this before, basically the communication between different disciplines. How it's just absolute key, man. And I'm actually longing for the opportunity. I'm starting my sports medicine rotation next, that I'm going to talk to these athletes and communicate more with the physical therapist and pick up the phone. And I'm just salivating next week that I'm going to see an athlete and they're going to be like, oh yeah, this happened. I'm going to get the number for the coach. I'm going to call the coach. I'm going to call hopefully not trying to not to violate any barriers, but obviously get the permission from the athlete and set up that rapport, set up that communication between disciplines. So we as healthcare professionals, we have to take initiative to do that at physicians. We have to check our ego at the door, as said before, and we have to be okay calling that personal trainer, because it's about the patient. And if we don't maybe convey, if the trainer doesn't call us to ask about, hey, is it cool for me 6 weeks after we do this, or because they don't know, right? I mean, maybe you do a procedure or maybe you do a surgery or something like that, and the tissue quality was really, really poor, and they might not be able to handle load or something like that. But if you don't communicate that, then ultimately the patient's the one who's going to suffer. And I think it's just tragic. To give you a classic example of, we do this on the inpatient side all the time. You're a couple of months away where you're going to be taking care of these individuals after a stroke, spinal cord injury stuff, and inpatient rehab is a beautiful situation because physical therapists are right there. And so when you're sometimes rounding, I'm not sure how Hershey does it, but sometimes we round and they're already in therapy. And I use every single one of those opportunities, if I round on a patient while they're in therapy, to communicate with the physical therapist. Just because I get sometimes more information from the physical therapist than I do. Because like at some point, it's like these patients are as stable as possible, right? If they've been with you for 2 weeks, asking them a review systems about chest pain, fever, like abdominal pain, like there's no need. That's fine. You ask them if they had diarrhea yesterday, they didn't, today, they'll let you know if they have diarrhea. But asking a physical therapist who is with them for an hour, hey, how are they getting up? Are they getting better getting out of a chair? Are you seeing progress there? Are they getting better combing their hair, brushing their teeth, doing ADLs and stuff like that? Rather than the abbreviated physical exam I do when they're in the bed, I'm not getting any information out of that. Nothing valuable, at least. So I think that's something that's really, really important.
Yeah, 100% agree with you, man. I think, it's awesome you're going to have the opportunity to do that. The best that I can really do, man, here right now, my intern year, is asking the overnight nurses what's going on and then putting in consults and hoping I don't get yelled at, right? Yeah. But no, I completely agree. And, Ronald Epstein talks about this in his book, Attending. which is all about being in the present moment with your patients. And I think a lot of times, like, the barriers to why we don't do this in medicine is, one, we think that there's more work involved, right? Oh, now I have to make a phone call. What if there's more paperwork, right? And we already know medicine already has so much of that. Number two, checking our ego at the door. Maybe that individual, that doctor thinks they have all the answers and that they don't need the help of, another discipline. But what I've come to realize is, if I put in those extra 30 minutes to an hour up front in terms of getting a more detailed history, in terms of talking to the right people, I'm actually saving more time in the end, in the long run. That patient can get out maybe 2-3 days earlier. That patient sees a quicker recovery. And everyone's on the same page. There's less guesswork. And I think in the end, like you said, it's about the patient. And I think the patient, you will see the overall difference. And in the end, for me, it's a lot about burnout. That's how we end burnout. When we see those great cases where we actually see our patients getting better and not necessarily coming back into the hospital. So I think all of that is great care.
Absolutely, man. And to your point about spending the extra couple of minutes getting that history and stuff, it also reminds me of something that Alex King had talked about. When his patients come in, he spends the extra time talking to them, because just the conversation and building the rapport gives him the insight in which specific treatment is going to work, and also sets up the treatment to be more successful. Because there's no disputing that there is a psychological component to these treatments working, right? The placebo effect is very, very powerful, and I don't care if that's the reason something works.
Right.
As long as the patient is not suffering, right? We previously talked about the difference between pain and suffering, and how you can quantify pain, but it's hard to quantify suffering, and why it's so important to kind of ask that question. So, I mean, I think that's key as well. So couldn't agree more.
Very cool. Anything else you want to add in there?
No, man, I think the last thing that I'll say is, huge fan of him. That's one of the reasons I was super stoked to get him on here, just because of the education that he's been providing for the last couple of years, whether it's, over at Champion with Mike Reinold, and they've got an awesome podcast. Every week they release some really cool episodes. Not just Dan, but a couple of his colleagues are all amazing. Dan, what he's doing with Fitness Pain Free is really phenomenal. It's one of my go-to sources, and I can't recommend it highly enough. And not only that, I'll say that I'm putting my money where my mouth is. So I'm not really sure when we're going to end up releasing this, but I'm going up to see him for a consult, right? To kind of get a good thorough assessment and kind of help me with some of the issues that I've struggled with in terms of biomechanically, and see how I can optimize my own training regimen and be healthier long term. Because I hope people continue to follow him and definitely learn from him, because he's a good dude.
Yeah, I was you kind of just stole the words out of my mouth. I was going to recommend everyone kind of checking out his website, Fitness Pain Free, on Instagram. This guy's putting out amazing content. I'm learning something new every time he's posting, and it's definitely motivating me to check my ego at the door when I go into the gym, and look at life from a different perspective in terms of, sure, I want to get big and strong and all that, but I also want to limit the pain, right? So I think it's sage advice he's given out there. Cool.
For sure. All right, brother. See you next time.
All right. Sounds good. See you, man. All right, everyone. I really hope you enjoyed our takeaways, and please feel free to share whatever you take away as well. You can reach us at email at medicineredefined@gmail.com, and we would love to hear your feedback. And one last thing, remember Doc2Doc Lending I mentioned at the beginning of the show? Well, if you need quick and simple access to cash and are looking for physician-preferred rates, be sure to reach out to Doc2Doc Lending at drpodcastnetwork.com/Doc2Doc. Thank you for joining us today. And as a reminder, the quick disclaimer, everything in this podcast is for educational purposes only. It does not constitute the practice of medicine, and we are not providing medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues. Thanks for joining us.